We're going to take you live now to Queensland, where the Chief Health Officer is providing a coronavirus update.
Anyone that we know is a particular risk, because we're working continuously with the Victorian health authorities, anyone we know to be a particular risk, we're working with them to make sure they get tested. So we did have someone who returned and was a close contact of a known case, a known venue in Victoria, and they returned home to Mackay. So we've worked with them, we've got them tested, they're negative, and they're now in quarantine for 14 days from when they left. So anyone we know who is a close contact or even a casual contact, we're working with them to absolutely get tested. I'm just asking other people to come forward. Of course, anyone who has any symptoms anywhere in Queensland, no matter where you've been, should definitely come forward. We've stood up more clinics and we've extended hours, and we've worked with people who've come along to those clinics to get them tested. We do have those 76 clinics, so I would stress that people look around for other clinics. There are 76 clinics across the state, 18 in South East Queensland, so I would prefer that people, instead of all going to one clinic, go to one of the other clinics. It's not under capacity. We've got 76 clinics open throughout the state. They've been open throughout the period, and people have been coming forward and getting tested. I've spoken to my colleague at the Commonwealth, and they're going to reopen some of their clinics earlier than they had planned to after the Christmas New Year break. I'm very grateful to them. So the public sector did stand up more capacity because other sectors such as GPs and the private sector had withdrawn a little bit, so they're now coming forward again. So I believe there is plenty of testing capacity throughout the state. People just need to look around for it.
And there were reports that staff at the WHO weren't aware of the changes that were announced yesterday, which could have led to that backlog. Are you aware of that?
Their managers were aware, and they put in place extra processes. So the message mightn't have got down to the staff in the clinic, and that's understandable, but they're there to do that job. They're there. It's more about bringing more staff in from outside, which is what their managers were doing.
And there was talk this morning from people who had been online last night. They went to the RBWH because it was the only one that had late night testing.
That's true.
Is that why everyone got to be tested last night?
Yes, so a lot of other clinics now have extended their hours.
Dr. Young, just on that, how much is it concern for you to hear people kind of go, oh, the line's too long, let's just go home, because that's where people could slip through.
Exactly. That's why I'm here this afternoon, and that's why I'm so grateful to all of you being here this afternoon, so I can get the message out that we have a lot of testing capacity out there. It's just that we mightn't always have enough in one particular site, because those sites are limited by the size of the numbers of people who can come. So that's why I'm saying, please, could people look around and go to other sites? Don't just pick one or two, which is what we saw yesterday. It's really important that people go online and look at where there are other testing sites and use them.
The capacity is depressed at the moment because from the amount of tests that happened on Friday to Saturday, over the 20th, there was actually a decline in the rate of testing. So are you happy with how it is at the moment?
I can understand why there was a decline. We were very much in a holiday period. We've come out of that. So I'd ask that everyone return to getting tested. As we saw before the Christmas New Year holiday period, people were very active at coming forward and being tested. I'm sure that will happen again. So it's really important. The most important people to get tested is anyone with any symptoms. That's critical. And then I would also ask people who've been down in Melbourne. Yes, so we're working with Cricket Australia to finalise those arrangements. We've had a lot of discussions with them. They've been very useful, and I think we're very close to finalising the arrangements.
And do you think it will get to when do you think the arrangements will be finalised?
That will be up to Cricket Australia. So we've almost completed the work to sign off their protocol, which was very thorough, very appropriate, and then they'll then have to decide what they do after that.
And are they a bit lax? And so we heard heard that there will be a very strict bubble. And have there been considerations to relax that a bit?
No, we've been quite firm that, of course, we need to put in place firm arrangements, and Cricket Australia fully understands that, because these are people who are coming from Sydney, and we are seeing, as late as yesterday, an unlinked case in Sydney. So there is clearly transmission happening in the community down there, so we do need to have those firm arrangements in place.
Is keeping Queensland safe from COVID-19 more important than, I guess, is it worth risking losing this cricket match?
I think the cricket match can go ahead with the proposal that Cricket Australia has put to us and with the protocols that we have in place. I've got no concern about the match going ahead, as we've been working through the details that they've put forward.
That was Queensland's Chief Health Officer, Dr. Jeannette Young, encouraging residents to come forward for testing if symptoms develop and to visit other testing clinics.